Hey mamas, there is something so special about pregnancy that really brings pregnant mamas together. We love talking with each other, we love sharing different experiences, similar experiences, getting questions answered. And so as a childbirth educator and a pregnant mama as well, I am going to be spending this video asking some questions that you guys have been asking me. And I know that a lot of times when we don't get our questions answered, we feel like we're lacking community, or we feel like we're disconnected, or we're lacking education or empowerment. And so we are just going to hop right into this video. I'll be sharing about my own pregnancy and birth and labor and a little bit about postpartum as well in general. So let's get started. So one of the most common questions that I get is, how has this pregnancy, my second pregnancy, compared to my first pregnancy? And a lot of things have been the same, but like more exaggerated. So I had morning sickness for my first and morning sickness with my second, but the second time I felt like it was a lot worse than the first. With the first pregnancy, I was not throwing up as much and was just dealing more with nausea and food aversions, and this pregnancy I've been dealing a lot more, at least in the first trimester, with a lot more throwing up as well as the nausea and food aversions. I did not have any pelvic pain or really low back pain in my first pregnancy, and that is something that I have been struggling with. And honestly, I think it's because I have a toddler who I'm holding up on my hip a lot more. I'm bending down. I'm doing a lot more activities that I didn't do in my first pregnancy. And so I think because of that, I have created an imbalance in my body. And so right now we're on the road and we're not at home. We're not into like our normal community, but when we do get home, I'm going to go see a chiropractor. If you are experiencing pelvic pain, I do have a video about what I've been doing during pregnancy to help with pelvic pain as far as stretches and movements that I've been doing, that I will link right up here. But I also have another video which I will also link up here and down in the description below about how to manage pelvic girdle pain, which a lot of women experience during pregnancy. And so that's something that I've been experiencing. And if you are a mama who's been dealing with that, make sure you watch the videos that I've linked, but then also make sure you try to see a chiropractor, because they are going to really help with making sure your body is aligned and making sure you are balanced so that you can resume normal, happy, healthy living. And so those are two things that I would say are the biggest difference in this pregnancy, is that the nausea, morning sickness was a lot worse. And I have a video all about what I've been doing to help manage that in the first trimester. So I have that video linked down below as well. And then that pelvic pain that I didn't experience during my first pregnancy either. So the second question is, are you going to find out what you're having? And I am 21 and a few days pregnant, 21 weeks and a few days pregnant. And so we were supposed to find out like last week what gender we are having, but because we are in California, we are going to wait until later on in October to find out. But yes, we are going to find out which gender it is, so we'll see. I really have no idea. I want to say girl because I have had the same symptoms as I did with my daughter in her pregnancy, but my mom was also really sick for all of her pregnancies, so I have no idea if I'm having a girl or a boy, but I'm happy with both. The next question is, do you ever struggle with anxiety? And if so, how do you reassure yourself? And I think as pregnant mamas, it's really easy to be worried about our babies. It's really easy to become overly anxious, especially in the season of life that we're in with COVID and kind of life feeling really crazy. And so as pregnant mamas, of course, we're worried about our babies, we're worried about, you know, our other kids, we're worried about our own health, we're worried about the state of the world. But it's really important during pregnancy that you manage your anxiety. And so for me, I don't struggle with intense anxiety, but I do have bouts of anxiety, especially at night like I'll just have a thought that kind of spirals me into anxiousness. And so what I do when that happens is really take time to focus on breathing and that really slow, rhythmic, deep breathing, and then affirm myself and what I know is true. I speak those truths over myself to help me remember that, you know, it's not all crazy, it's not all bad, that, you know, I can trust that I was made for such a time as this, and my baby was made for such a time as this, and that I can trust in, you know, the plan that our lives hold. And so I love doing affirmation meditations. That's why I've created the Built to Birth affirmation meditations for you mamas, because it's not just something that I'm throwing out there and, you know, hoping something will catch on, but it's because I know how effective they work. And so I've felt so empowered by affirmation meditations that I've created them for you guys. So if you want affirmation meditations to help guide you through your pregnancy, through your labor, your birth, and then a little bit into your postpartum period as well, I definitely recommend checking out the Built to Birth affirmation meditations. They are linked down below, and they really just help guide your mind to lead your body in the direction that you want it to go, because our minds can spiral out of control, and that is especially true during pregnancy, and especially true during labor and birth. And we want to use the strength, the power of our mind to lead our body in the direction that we want it to go. And we can do that through our pregnancy when we are feeling anxious. We can do that in labor if we're feeling anxious. And we can do that in postpartum when we're feeling anxious. So make sure you check out those Built to Birth affirmation meditations if you haven't yet. They are linked down below in the description. So the next question is, have you experienced heartburn? If so, how do you treat it? So heartburn is very common amongst pregnant mamas, just because of all the hormones and chemical changes that are happening in their body. And so it can come out of nowhere when you become pregnant, or it can be something you struggle with and then it gets worse during pregnancy. So for me, I don't really struggle with heartburn, but I struggle with a little bit of reflux, as in I'm burping a lot. So that was mostly in the first trimester. It's kind of settled out now in the second trimester, but it might come back in the third. But during the first trimester, what saved me from that disgusting burping, and what helps with heartburn a lot and is a natural remedy, is papaya enzymes. So I just use this. I picked these up from Amazon. There we go. So I picked these up from Amazon. They're just papaya enzymes with chlorophyll, the after meal supplement. So this helps with nutrient absorption and then also helps with digestion. And so it really helps settle food, and it's a natural remedy. And so it's not like you're always popping in Tums. And so they taste pretty good. You just chew them after you eat a meal. I think it's 3 after each meal. And so they really help just settle your stomach. And so if you're dealing with heartburn, or you're dealing with gross burps that you just hate, then I would definitely recommend getting papaya enzymes. And so I will link these down below in the description for you to get. So another question that I was asked is about a big topic, hospital births during COVID. And for me personally, I did not choose a home birth because I was scared of giving birth in a hospital during COVID-19. I just felt like I was ready to give birth at home with the experience that I had last time. I just felt very comfortable and confident. But I also feel that if a hospital birth is necessary for me, I am not afraid to give birth in a hospital setting because of COVID-19. They are taking really careful precautions, especially for pregnant mamas, to make sure that they are staying healthy while they are at the hospitals. The big thing that I would check in on is your hospital's policy on who can be at your labor with you in labor at the hospital, as well as what their regulations are on masks, because a lot of mamas are kind of going into the hospital thinking they're going to labor without masks and then realize that they have to have a mask on, or it's totally different. And so I would ask those questions beforehand so that you are prepared, one, so with your birth team, so that you know who's going to be with you, and two, so you know how you are going to be managing your labor with or without a mask on. So the next question is third trimester sleep positions and exercises for back/hip pain, 25 weeks and uncomfortable. Mama, I totally feel you. My hips, especially at night, just feel so tight and tense. And so the best thing that I can tell you to do for that is to be active during the day. So going on walks frequently so that you're moving your body, and then stretching during the day as well as before bed. I also recommend not sitting in a chair for long periods of time, and if you do have to be sitting and you can't stand up, then find a birth ball that you're able to sit on, and especially if you're doing computer work. And that's what I do, and that helps a lot. I noticed on days where I've been sitting in a chair for a long period of time, those are the nights that are harder, or days where I haven't been as active, days that I haven't done my stretches, done my prenatal yoga. Those are all nights that are harder for me. And then the other thing is to make sure you are sleeping with a pillow between your legs so that you are creating alignment throughout your body. So with a pillow between your legs aren't going to be like this. There's going to be this nice separation, and that makes that hip pain and lower back pain a little bit more manageable. And then the other thing is to make sure that you are consuming enough magnesium. Most people are deficient in magnesium, and magnesium can really help during pregnancy relieve a lot of the crampiness that we get in our legs and lower back especially. So there's a supplement you can take called Natural Calm, which I love. And then there's also like lotions that you can get that can really help relieve some of the tension, the back pain, the leg pain or groin even, because magnesium is absorbed through the skin. And so I will link the lotion, the supplement, and also taking Epsom salt baths, because Epsom salt has magnesium that your body like sucks into it. And so that helps a lot with those muscle aches as well. So I will link those 3 things down in the description below for getting a better night's sleep when you are feeling uncomfortable from those hip pain, that lower back pain that is so common during pregnancy. So next question that I got is, what would you personally do if you knew you had to be induced? And so with this question, I want to be clear that this is what I would personally do, and this is not what I recommend every woman to do, and it really depends on the circumstances. And so in order for me to feel really confident that a induction is necessary, I would make sure that I ask these 3 questions to my care provider. The first question is, am I healthy? Okay, if I am healthy or if I am unhealthy, that is going to help determine whether or not an induction is really necessary. The second question that I would ask is my baby healthy? So again, if my baby is healthy or unhealthy, that is going to determine whether or not I decide an induction is necessary. And then the third question that I would ask is my baby's home healthy? Because again, if it's healthy versus unhealthy, that's going to change your mind on whether or not an induction is necessary. So for me, regarding my baby's current home, is their placenta healthy? Is my amniotic fluid okay? Is my uterus looking fine? And if the answer to all of those questions is yes, you're healthy, yes, baby's healthy, yes, their home is healthy, everything's safe and healthy, then I would say, okay, an induction isn't necessary. However, if a situation arises where some or all of those questions are no, it's not healthy, then I would approach an induction with positivity, because I would know that it's keeping me and my baby safe and most healthy. And so I would probably start off with the Foley bulb, which is a manual dilator. And so they put it up by your cervix. They will often give you a cervical ripening agent as well to help soften your cervix. And so I would take either a Cervidil or a misoprostol and a Foley balloon to see if that can kickstart labor. So that is how I would begin an induction if it was something that I had to do. But I would always make sure you ask those 3 questions to your care provider if an induction is something that you're facing. Okay, and then the last question that I want to answer, because I don't want to keep you guys forever and I don't have all the time in the world, even though I would love to sit here and chat with you guys and answer so many more of these questions, I will keep these on my phone so that I have them for future video references. And the last question that I want to answer is, my family is not on board with my birth preferences. How do I get them on board? So whether that be a home birth or an unmedicated birth or whatever kind of birth, you want to have the support of those who are going to be most involved in your birth experience. And so I would encourage you to say, hey, why isn't my family or close friends or my birth team, why aren't they on board? Is it because they're concerned for me, or is it because it's something they don't feel that, you know, I can do this? Let's say it's an unmedicated birth. How can I, they don't think that I can do this. How can I approach them about this? And I would just encourage you to say, this is your body, this is your birth, this is your experience. And so be bold and confront your loved one and ask them to support you in that, because you are going to be the one who's doing a lot of the hard work. And then also make sure that they are educated about it, because a lot of times empowerment is taken away when someone is not educated. And so the more you know, the less you fear. And so maybe they are scared about a home birth, or maybe they are, you know, they think birth is not natural, it's not normal, and so it has to be medicated. And so I would really encourage you to both your whole birth team to take the Built to Birth online class, which is linked down below, because it is so full of information for both mama and her birth partner and birth team to help really encourage and facilitate labor and push it in the direction that you want it to go. It gives you so many tools and resources to help mama feel comfortable, to help the partner feel comfortable, to help the partner feel like he or she can be a productive part of the birth experience, to keep labor progressing in the direction that they want it to go. And so it comes with so many downloadable resources. It comes with the affirmation meditations. It comes with a birth plan that you can create. It comes with cheat sheets that you can bring with you in labor. And so it really just provides you with education that is going to help empower both you, mama, your birth partner, and your whole birth team as a unit. So those are the things that I would encourage you to do if you are facing some resistance with your birth team about your birth preferences. But that is the last question that I'm going to answer in this video. Thank you for all the questions that you guys have been sending me about pregnancy and labor and birth in general, as well as about my personal journey. So thanks for being with me in this video. I will be making so many more of these videos answering your questions in the future, but thank you for being with me today, and I will see you in the next one. Bye, mamas.